Good afternoon and welcome to our Promoting Research webinar. My name is Amanda Shea and I'm the Research Operations Manager at the Heart Foundation. The Heart Foundation acknowledges the traditional owners and custodians of country throughout Australia and their continuing connection to land, waters and community. We pay our respects to them and their cultures and elders past, present and future. Thank you to everyone for joining us live today. It's a busy time for most of us, so we do appreciate it. A couple of housekeeping notes. Your microphones are muted, but if you do have any questions, please ask them via the Q&A box at the bottom of your screen. If time permits, we will try to answer them during our question time at the end. For anything we don't get time for, we will try to follow up after the webinar. The webinar is being recorded and we will share it in our monthly newsletter next year. If you've just tuned in, welcome. The Heart Foundation is delighted to share some great examples of research promotion with you today. Earlier in the year, we invited our alumni to submit 3-minute presentations of their funded research projects. We were looking for presentations that could be used for a consumer audience, describing your outcomes or potential outcomes and the impact that you hope your research will have on the heart health of all Australians. We thank those who participated and congratulate our top 4 submissions. Each 4 will be receiving $1,000 to help them with translational activities such as creating journal articles, a professional development course, or attending domestic research conferences. They'll also meet with members of our advocacy and media teams to discuss promotional opportunities for their research. The research program is governed by our research and research strategy committees, and today we are joined by a member from each. Rebecca Davies is a member of the Heart Foundation Research Strategy Committee, and with her experience in consumer activities, she will be discussing why it is important for the Heart Foundation to promote research outcomes. Professor Robyn Clark, one of your fellow alumni, is also a member of the Heart Foundation Research Committee and will be introducing our 4 competition winners, as well as discussing why it's important for you to promote your research. I will now hand it over to Rebecca to discuss the importance of promoting research. Thanks, Rebecca.
Hi and welcome. And it'll be interesting for our 4 finalists. I'm sure they would reflect on how hard it is to actually present your research in 3 minutes. It's much easier to do something in 30 minutes. 3 minutes, or what people often call the elevator pitch, is so much more difficult. But why does it matter? I guess increasingly, and I'm sure you've all been noticing this anyway, funders, whether they're government or whether it's philanthropy, whether it's organisations like the Heart Foundations, are really looking to see that the research dollars that they're spending, which are very precious, are being spent in a way that creates the biggest impact. So that is the key communication message, I suppose, of today, that I'd ask everyone to be able to answer in 3 minutes or less the question of why does their research matter, so that it is understood by a wider audience. One of the things that any of us in any sphere, whether it's research or anything else, often find difficult is realizing what it is that we take for granted. So the language that we use, the concepts that we talk about, we assume everybody knows about them, but that may not be true. And I think you researchers are in a great space at the moment because the community over the last year has become much more invested in science and medical research in particular. Of course, we are all now expert epidemiologists, and I was just looking at today's newspaper in Sydney anyway, and there are multiple stories about COVID-19, of course, and we're all very concerned and interested in that. But there are also there's a story from the Chris O'Brien Lifehouse Centre, where I'm the deputy chair, about 3D printing and new technology that's being made available for the first time in Australia. And there was also an article about some new medical research that's being done in Queensland to help people that have got obsessive compulsive disorder. So you've got a community that is very open to hearing from you, but you need to be always thinking about what is it that the funders in particular want to hear about. So taking your own hat off in a sense and putting the hat of the listener on is really important. So, and some of you have heard me bang on before about the importance of consumer representation in your research, but I would also say that one of the areas in which an educated consumer can be very helpful is just having you practice your elevator pitch. If you can't explain your research to an interested consumer, then it might mean that you need to do a bit more work on it. And of course, the Heart Foundation is also there and very keen to help you in just thinking about how to present your research in a way that's going to really have an impact. So good luck to all of you on that space. You know, we're, as I say, we're in an interesting world with lots of opportunities. Those of you who are on social media can see how impactful it can be to, again, you know, in a, whatever it is, 140 characters or whatever, to be able to talk about the work that you're doing. So there's lots of skills that need to be learnt. We can't assume that because you've got a PhD in your particular field that you're expert in the communication space. And so I'd certainly encourage you to take that on. I think that's enough from me. So I might now hand over to Robyn, who's going to talk about this from an alumni point of view. Thank you.
Thank you, Rebecca. So I was speaking to Amanda the other day about the importance of the 3-minute presentation, and I was actually being interviewed on the radio about our geography work and accessibility to cardiac services project. And unbeknownst to me, riding in a taxi was the CEO of the Esri Corporation, who is the provider of the software that Geographical Information Systems is based on. And the CEO heard me speaking and said, I want that woman at our next conference. And the rest, as I say, is history. So it was my 3-minute radio pitch, which was passionately delivered, that actually got me a gig in the Esri conference in 2012. And that was just because I was speaking so passionately about my research, and there were people out there listening. So I can't begin to emphasize how important it is to have the skills, as Rebecca was referring to. I also think that this new initiative provides the Heart Foundation with a wonderful showcase of the brilliant people they are investing in and their world-leading research. But more important, if there was any doubt in the minds of our donors about how appropriately their funds are being used, then I just think you need to watch these 4 amazing 3-minute videos to be completely convinced of the future of cardiovascular disease research. And I'm sure you'll be assured that it is in inspiring hands with potentially global world-leading researchers. So our first video today, our first video we would be delighted to showcase is from Dr. Danielle Kamato. And Danielle is an NHMRC and Heart Foundation Research Fellow at the University of Queensland. And Dr. Kamato received a 2018 postdoctoral fellowship to investigate a novel link between periodontal disease and cardiovascular disease. So Danny, here's your video.
There is a strong link between gum disease and cardiovascular disease. Patients with gum disease are twice as likely to have heart disease. And for many Australians, this hits close to home, with approximately 1/3 of all Australians having moderate to severe gum disease. My name is Danielle Kamato, and I'm a Heart Foundation Early Career Fellow at the University of Queensland. My research seeks to define the novel link between gum disease and the onset of cardiovascular disease. By having a better understanding of how the disease is occurring, we can then identify suitable new therapies which can provide better long-term outcomes. In the arteries, we have these molecules called proteoglycans. As heart disease develops, these proteoglycans can become sticky and attract and bind all passing cholesterol, allowing for cholesterol to be retained within the vessel wall. Over many years, the cholesterol builds up and forms a plaque. This plaque can eventually rupture in a fatal heart attack. In our proof of principle experiment, we found that using a therapy that inhibits the stickiness of these proteoglycans can reduce plaque deposition by approximately 30% in an animal model of atherosclerosis. We have recently found that toxins that are released from bacteria can modify these proteoglycans so that they can become sticky and attract cholesterol. Our pilot data shows that the bacteria-derived toxin signaling pathway is a similar pathway to that we have previously observed by other cardiovascular disease stimulators. We are currently in the process of finding a common target that can be further studied to identify potential new therapies for the prevention of infection-induced cardiovascular disease. We expect that forthcoming studies characterize these therapeutic targets in cell and animal models. We anticipate that the success of this project can lead to the identification of a new class of therapies that target the disease process occurring in the vessel wall, and they can be used to complement existing therapies and provide better long-term outcomes. Thank you for your attention.
Fantastic project, Danny. Well done, and an excellent video summarizing your research. So, Rebecca, did you have a question for Danny?
And I was, from a consumer point of view, I was fascinated by this because I can see how, you know, I just wonder, and you might have some comments about this, first of all, whether you're having any interaction with researchers in the dental side of things. And secondly, I'm thinking from a patient point of view that I don't think that there's a lot of interaction between dentists and cardiologists, whereas this might be, you might be discovering an early warning sign that if I've got gum disease and my cardiologist knows about that, or my GP knows about that, it will be a great opportunity for sort of a closer watch on me. And so this could be really significant, at least for a proportion of the population.
What do you think, Danny?
Yeah, so we have spoken to a cardiologist here at the Princess Alexandra Hospital. And after we'd found this data in vitro, we asked her, what do you think about this link? And she says that most of the patients that she has that come in for open heart surgery do have gum disease. There's also been some studies at the School of Dentistry here at UQ where they've injected mice with bacteria that comes specifically only from the gums, and that they found that there's an increase in the lipid deposition in these mouse models. So both when we've spoken to dentists, they have been looking at that link, and then it was observed by cardiologists that many of their patients do have some sort of gum disease, even if it's moderate.
Danny, as a nurse, many of my patients talk about gum disease as a consequence of smoking, whether they were previous smokers or current smokers. And we were aware of this research a few years ago. So as nurses in cardiac rehab, We have been talking about having really good dental hygiene, flossing, brushing, etc. Is there a link between the smokers and your research, and what additional advice would you advise me and other nurses to give to patients about dental hygiene as an interim precaution to your excellent research is fully translated?
So for the first part of the question, we haven't studied the link between smoking and cardiovascular disease in terms of the periodontal link, because there's obviously many links with smoking and cardiovascular disease as well. For oral hygiene, they do say that, brushing and regular checkups do help prevent the plaque buildup and then the bacteria going through into the system. So that there is a link between having good oral hygiene and an improved severity of cardiovascular disease.
And it's interesting too, because this could really lead to significant government policy change, because we know that dental health, it sort of doesn't get the same priority as some other areas. And a lot of people, particularly disadvantaged people, can't afford that sort of good oral care. So if we were able, if your research is able to establish that there's a significant link, that would be a strong argument to say, you know something, we should be putting dental care on the Medicare system rather than leaving it where it is at the moment.
Yeah.
Now, Danny, my advice is to get Rebecca onto your translation team, because that is exactly what research funders are looking for, the link between your lab research and the translation into real world practice. What Rebecca has just articulated is an excellent example of translation into real world policy and practice. We have the chat room open if you want to send in questions. We may take some more questions at the end if we have time. So I think we'll move on to our next presentation. And Danny, if you don't mind staying available, we might come back to online questions to you at the end. So our next speaker is Yugeesh Lankadeva. Yugeesh is a Heart Foundation Future Leader Fellow and a laboratory head at the Translational Cardiovascular and Renal Research Group at the Florey Institute of Neuroscience and Mental Health. Today, we are going to hear about new strategies towards reducing the risk of acute renal injury resulting from cardiopulmonary bypass surgery and sepsis. Thank you, Yugeesh.
My name is Dr. Yugeesh Lankadeva, and I currently work at the Florey Institute of Neuroscience and Mental Health. Did you know that every year over 20,000 Australians undergo major cardiac surgical procedures to improve their heart health? Taking a brief history of time, the development of heart surgery using the heart-lung machine was one of the biggest medical breakthroughs of the 20th century, because this allows cardiothoracic surgeons to operate on motionless and bloodless fields while the patient's cardiovascular system and brain is sustained by the heart-lung machine. However, there is major risks associated with this surgery. For instance, it can injure the kidney in up to 30% of the patients, leading to the development of postoperative acute kidney injury. The development of postoperative acute kidney injury not just increases your chance of dying in the hospital in the short term, but in the long term, it can increase your chance of developing chronic kidney disease that can substantially diminish a patient's quality of life. Therefore, new effective treatments are urgently needed. This is where my research comes in with the help of a Heart Foundation Future Leader Fellowship. Over the last 3 years, we have generated compelling data that there is substantially reduced oxygen delivery to the kidneys during heart surgery that can injure this organ, leading to the development of kidney dysfunction. However, it's currently not possible to directly measure kidney health in patients undergoing surgery. So to counteract this, we have developed a non-invasive clinical biomarker that allows us to continuously monitor kidney health in patients undergoing heart surgery. I'm very excited to say that our discovery has already translated into several promising clinical trials at Austin Health, Monash Health, and Royal Melbourne Hospital. Now that we have this technology, our focus is now to develop new treatments to prevent kidney injuries from arising from heart surgery. It was actually with the help of a Heart Foundation Early Career Fellowship in 2016 that I was able to initially repurpose an already existing clinical drug to reduce kidney dysfunction in another life-threatening illness called sepsis. Using this extensive knowledge that I have generated over the last 4 to 5 years, we have been able to now repurpose this drug to the setting of heart surgery in an attempt to prevent kidney injuries from taking place. We have exciting new evidence that this drug may not only protect the kidneys, but it may also protect the brain during heart surgery. Now, with the help of a Heart Foundation Vanguard grant in 2020, my vision is to develop a new interventional strategy so Australians can feel safe in the future to undergo these essential surgeries, not just to improve their heart health, but come out of these surgeries preserving their brain and kidney health as well. I'd like to sincerely thank the National Heart Foundation for continuing to support cardiovascular researchers such as myself, so we can continue to strive forward towards improving the heart health and quality of life of all Australians. Thank you.
Thank you, Dr. Lankadeva. I don't know if anyone's told you, but you have a fantastic voice that you really meant for ABC Radio. That was a wonderful presentation.
Thank you. I've never been told that before, but thank you very much.
Well done. So a biomarker that protects your kidneys and brain during cardiac surgery is an amazing giant step forward for research. So what will be the future translation of your research? What will it look like?
I guess what I would like to do is to find, currently there is no direct way of monitoring vital organ oxygen delivery and perfusion during an invasive surgery like an open heart surgery. So I guess our goal is to first develop these non-invasive, indirect ways of getting a good indication of how the organs are functioning while the surgeon's operating on the heart. So hopefully we can use that time to optimize blood supply and oxygen delivery to these vital organs during that surgery. So when patients' heart recommences from the machine, that these other organs are not injured. So it's not just that you're going to that surgery to protect or repair your heart, but you come out of that surgery protecting or preserving your other organ function as well. That's our goal.
That's fantastic. Rebecca, what do you think?
Well, I mean, your presentation is both scary and optimistic. I guess I wasn't really conscious of these extra risks because I haven't been through open heart surgery. But, you know, so that was the scary part, to think that this could happen. So a couple of questions about that. Do you have any information, or would this be something that would be worth studying, whether there are particular characteristics? I'm thinking about using big data to be able to identify which are the kinds of patients that might be more at risk of these complications. And could your technology be used to perhaps identify the people that are at higher risk before they go into surgery so that the surgery can be managed in a different way? Does that make any sense?
No, absolutely. And I think that's where I think, as you hit the nail on the head, big data could come into play, because I think if you can look at the patient's characteristics and the comorbidities that they come in with prior to the surgery, I think we can use that data to stratify the high-risk patients from the low-risk patients. I mean, for instance, most of these patients who go through these surgeries have heart failure, for instance. And heart failure is associated with other diseases like chronic kidney disease. So if you already have a pre-existing renal impairment before an open heart surgery, the chance of you having a further exacerbation in that surgery is quite high. And I guess, I mean, this is one thing that really excited me about the heart surgery is we know what the initiating insult is. I mean, with sepsis, it's very complicated because we don't know when the patient first acquired the infection. So time zero is really unknown, but in the case of the heart surgery, we know what time zero is, which is the initiating insult of the surgery. And I think this puts the perfusionist of the heart-lung machine in the optimal place if he's got the information to actually optimize things to these vital organs.
So, Dr. Lankadeva, you also spoke about therapy. So you talked about monitoring and therapy and perhaps some drug therapy to treat sepsis and protect kidneys and brains. What drug are you allowed to talk about the drug therapy? And is this in a research phase or is this part of your research?
No, I think I can talk about it. I mean, it is called dexmedetomidine. So it's a alpha-2 adenoreceptor agonist. This was initially used as an antihypertensive medication. And the unique thing about this drug is that it acts on the brain to reduce nerve activity or sympathetic nerve activity down to the organs. It also has anti-inflammatory effects as well. So both these things like inflammation and enhanced activity of the sympathetic nervous system both play a big role in mediating organ dysfunction, both in the context of sepsis and also heart surgery. So I think this is why this drug is very promising. And in the sepsis field, we were able to show that it has very good benefits towards the kidney. So it was just a logical step for us to kind of take that drug and then perform some dose finding studies to optimize the dose that really brings about these benefits in open heart surgery.
Fantastic. Congratulations on your presentation and winning the prize, and congratulations on your research. While we're waiting for chat questions in the chat room to come through, we'll go to the next presentation and we may come back to you at the end. Thanks again, Dr. Lankadeva.
Thank you.
So our next presentation is from Professor Amy Brodtmann. Professor Brodtmann is a stroke and cognitive neurologist at the Royal Melbourne Hospital, Austin Health and Eastern Health, and a clinician researcher at the Florey Institute of Neuroscience and Mental Health. I think Florey Institute might need to set up a film studio after this competition. So Dr. Brodtmann is going to talk to us today about the drivers and determinants of vascular brain health in identifying risk and protection for vascular neurodegeneration. We look forward to your video.
Hello, my name's Amy Brodtmann and I'm a neurologist in Melbourne who is the lucky recipient of a Heart Foundation Future Leader Fellowship for the second time. So I feel incredibly grateful to all of the supporters of the Heart Foundation for this fantastic award. My projects are really looking at vascular risk and how they affect brain health. And I suppose my research overall is how vascular disease can affect the brain. I'm interested in both the pathology, the bad things that happen, and also what behaviours make our brain healthier, so the neuroprotective things that we can do. Some of my projects over the next 4 years that are going to be captured in this grant include looking at how an irregular heart rhythm called atrial fibrillation affects our brain. We've known for years that it's a very strong risk factor for stroke, but now we know that it's also a strong risk factor for cognitive decline and dementia. We don't really understand why that is, whether or not it's because people have more strokes or whether it's because the same processes that are leading to the heart irregular rhythm are also causing changes in the brain. So as a first step, we're going to look in the ESPRI study, which is a big study of people over the age of 75, to see whether or not people who have atrial fibrillation have different cognitive processing to people who don't. And that's going to be probably over the next year or so that I'll be looking at that. One of the big projects that the Heart Foundation has supported me in for a number of years, including in my prior work where we did some pilot data for this study, is looking at the brain benefits of exercise. We've known that exercise is good for your heart, it's good for your brain, it's good for your mood. But one of the things we're really interested in is whether or not it's good for your brain after stroke. People after stroke are often worried about exercising because they've just gone through rehab and they're concerned that they don't want to change their blood pressure. But we know that the fitter you are, the less chance you have of having a stroke or even another stroke if you've had one already. And we also know that the fitter you are, the less chance you have of having dementia. So what we're going to do is we're going to recruit a group of people after stroke. After they've finished rehab, we're going to exercise them for about 8 weeks. And we're going to actually look at their brains by looking at their brain scans to measure the different volumes of different parts of the brain. I want to answer the question, does exercise stop your brain from shrinking after stroke? And hopefully we can do that in this study. So thanks again to the Heart Foundation. This is just critical support in this difficult funding time. Thanks to the Heart Foundation board, to the scientific panel, and to all the donors who are supporting brain health, because I think it's really critical to realise heart health is brain health. Thank you again.
Wow, Amy, that is amazing. And I'm sure Rebecca is busting to ask lots of questions.
Well, again, this is an area where everybody's vitally interested in the answer. And I guess we can assume that we know what the answer is going to be, but your research and your ability to so passionately talk about it is perhaps going to make the difference between people kind of knowing this stuff, because we know that exercise is so important in so many areas. But if you can tell me that after stroke, if I don't exercise, my brain is going to shrink by whatever your outcome ends up being, that might actually make me do something rather than just, you know, the more general stuff that we, you know, that we all know that we should eat healthily and we shouldn't smoke and we should do all these things. But this is making it much more specific. And have you, again, a similar question I asked with one of the other panelists, have you been talking to other researchers who are looking at exercise as I suppose, an ameliorator of risk factors in a whole range of other areas, or is this sort of more specifically in that dementia space?
No, absolutely. It's something that my researchers is the same for many people here. We're very collaborative, and this project is a group of, includes me, a neurologist, and there's a couple of other neurologists, plus someone who's an endocrinologist, cardiologist, people who are interested in, who are exercise physiologists, physiotherapists, occupational therapists. You can imagine everyone's pretty interested in this space. For me, it's really trying, you know, as I work in clinics and see people with cognitive impairment, and we talk about a protective lifestyle. And I think that I want to be able to say, if you exercise, you can change your brain atrophy rates by this amount. And we know that even though it's the biggest fear for people over the age of 55, and it's bigger than cancer, to they're frightened that they'll get dementia. And I think that we'll need to have a carrot and a stick and say, be afraid, but this is what you can do.
Congratulations, Amy. I think, as Rebecca said, your 3-minute pitch sells your research so beautifully that I can't imagine that anyone would refuse to come into your trials, and it's a great asset for Florey to have you. I'm really interested in your pilots data, if you could talk a little bit about that. So what exactly, how much exercise do stroke patients do normally? Because I'd be thinking you might be coming from quite a low benchmark there. And what does your, when you say exercise, what does that look like? Because I'm putting myself in Rebecca's shoes. I've just had a stroke and you say, right, we're off to exercise. I'd be thinking, well, okay, does this include lycra pants, or what are you asking me to do?
Lycra's optional, Robyn, you'll be pleased to know, but if you want it, you can have it. So I'll just answer your first question. You said, what sort of exercise are people doing after stroke? And the answer is almost none. So people who were, people who were prior exercisers obviously are already protected from stroke, and so they'll return to their normal exercise. Julie Bernhardt, who's involved in this study, has mapped this and shown that they're sedentary and very, very unfit. And one of the big things about this study is that fitness is important, and we're actually measuring it formally because of our excellent exercise physiology group. What we're doing is we're looking at two arms to the study. So it is an RCT in the sense we're looking at two interventions, two different types of exercise, sort of aerobic and a resistance, balance and stretching group. And it's important that we do compare them because we don't know whether exercise is just good for us overall or whether it's because we get fit. So I imagine that those who were running, not necessarily running, but increasing their aerobic fitness will probably get their Lycra on.
And I have seen studies using yoga in, are you going to include, could be more like stretching exercises or gentle like Tai Chi for those who have more disability from their stroke?
We're randomising them not by their disability. I'll answer that in two parts. So there is a stretching arm, and we certainly people find that important and useful. There are other groups who are specifically looking at yoga and mindfulness as an intervention after stroke. And I'm involved in some of those studies that are being run out of Monash with Dominique Cadillac and her group.
And Amy, can I ask another question about the future, I suppose, and where this might go to? Are you going to get behavioural scientists involved as well? Because that's an area that perhaps often gets overlooked, but it's very important to get from that sort of discovery base point to actual behaviour change.
Absolutely, and we have looked at some of the impediments to exercise for people, and they mainly are behavioural. Yes, we will be. This is a phase 2B study. This study that we're running. So if the results are positive, and we're using brain volume as our primary outcome. If we go to a phase 3 study, then we'd obviously have cognition as the primary outcome, and absolutely we'd need to get, I want everyone running in the park after their stroke, and if we're going for that to happen, then we're going to need probably a team of behavioural people, change consultants.
Thank you, Amy. You've got me in my Lycra. I'll be in the park there to join you. So our next, we'll wait for some more chat questions to come in for our panel at the end. Amy, if you would like to join us then again. So our final presentation, our final alumni video is from Dr. Yung Yang. Dr. Yung Yang is a research scientist within the cardiovascular endocrinology group at Hudson Institution and a consultant endocrinologist at Monash Health and a senior postdoctoral fellow in the School of Clinical Sciences at Monash University. And Dr. Yang is going to talk to us about early detection of primary aldosteronism, an underdiagnosed but frequently curable cause of hypertension. Let's have a look at this amazing video.
You know, as a doctor, I've always found hypertension or high blood pressure to be a hard sell. You can't see it, and often you can't feel it. And yet it's a silent menace that can cause debilitating strokes and life-threatening heart disease. And what's more, we don't even know what causes it most of the time. But what if I told you that a staggering 15% of people with hypertension, that's hundreds of thousands of Australians and millions around the world, unbeknown to them and their doctors, their bodies are actually making too much of a hormone that causes a high blood pressure. And for many of these people, a simple intervention can lead to a cure of this disease forever. You'd say it was a game changer, and you'd be right. My name is Dr. Jun Young. I'm an endocrinologist researcher at Hudson Institute of Medical Research, Monash University and Monash Health. For years, I've been interested in a condition called primary aldosteronism. It's a silent killer, but it's a killer with a distinctive marker. And it's easy to find if you know where to look. When our blood pressure drops, our kidneys produce renin, which then tells the adrenal glands on top of the kidney to make a hormone called aldosterone. Aldosterone then tells the kidney to keep salt in the body, thereby increasing our blood pressure back up. In primary aldosteronism, the adrenal gland is overactive and continuously churn out aldosterone. And so the blood pressure goes up and up and up. Primary aldosteronism has been considered rare, but I think it is much more common than we realise. GPs in Victoria diagnose it in 1 in 1,000 hypertensive patients. But here's the thing, it only takes a simple blood test to measure a raised aldosterone level, just that no one thinks to order the blood test. In an Australian first study, sponsored by the Heart Foundation, I asked GPs from 20 clinics in Victoria to screen every newly diagnosed hypertensive patient with the blood test. And we found that 1 in 6 or 15% of these patients had primary aldosteronism as the cause of their high blood pressure. This condition can potentially be cured with removal of the gland or safely treated with a medication that blocks aldosterone action. I believe there are many Australians living with undiagnosed primary aldosteronism. Their blood pressure is therefore difficult to control, and what's worse, at this very moment, they're at increased risk of early death from stroke or heart disease. A simple blood test could change the course of their lives and even lead to a cure of their condition. If you have hypertension, have you had a blood test for primary aldosteronism?
That was brilliant, Yon. That was absolutely brilliant. So well done and congratulations. I'll start the conversation with perhaps the creative fill methodology that you were using there. And I think you were telling us a story by changing locations. So do you want to talk us through how your scene changes were related to the story? Because that might help some of our audience with their creative videos for next year.
Well, first of all, I have to really thank the Heart Foundation for having this competition, because I'm terrified of social media and looking at myself on video. So it was a challenge and an interesting one. And then I have to thank my husband. I think he watches too much Michael Mosley's doctor shows. So he was trying to create something that was a bit more interesting, because I would have thought just filming in one room would be sufficient. And our first location, I'm not sure if anyone's been there, but it's actually a very beautiful cemetery. We thought that might be an interesting location to talk about a disease that leads to early death. So it's a little bit morbid in that way. And then we progressed towards our, towards the hospital and the laboratory, and then back in an office setting. Yeah, just break it up a bit.
I also thought that you were telling us the background in the real world, and then when you were talking about the physiology, you were in the lab, and so that was obviously appropriate. And then when you were talking about the management, you were talking both in the hospital and then in the GP office. So the story flowed really nicely as your text flowed. So there's on the chat, there's accolades for your producer and director, for your husband. So well done. I'm also interested in the methodology that you're going to use, because it seems to me that you might be a knowledge translator and implementer. You've got to get doctors to prescribe these tests more early, more frequently. So talk to us about your methodology for your research.
Yes, so now that we've done this preliminary research showing that the disease really is very common and that it only takes a simple blood test to find it, I'm now collaborating with the primary care doctors, because they are the people at the front line of hypertension management. And we're developing an MIFF proposal, or perhaps a partnership proposal, to involve primary care physicians, translation scientists, health economists, to try and work out, what is the best way to get GPs to change their practice and assess high blood pressure using a blood test as one of the first line tests, so that we can diagnose the disease early in the process, rather than waiting for many decades of poorly controlled hypertension and end organ damage. We would like the translation scientists to teach us, or to work out some strategies that will really change practice, because giving knowledge is one thing, but to actually change the way things are done is another. and the health economist will contribute to, is this whole process cost effective? Because I think the government would like it if we can save some dollars rather than creating a process that cannot be supported by the health budget.
And I must say, I love the fact that you're thinking about that, because oftentimes researchers don't think about the financial side of it. So having a health economist involved is really good. Just a quick question: have you found it hard to find one, because there's not so many of them and there's a lot of demand?
Do you mean patients with a disease or
health economists for your
No, we found a very good health economist based at Monash University.
Oh, good.
We're already doing the preliminary analysis, building up a model. And at this stage, it appears to be highly cost effective, because the blood test itself is only, it's the same cost as, a full blood count, a very routine blood test. And yet you can save money on preventing polypharmacy. So, instead of taking, say, a handful of antihypertensive drugs, you just take the one that's targeted, or perhaps even receive a surgical cure, and you'll reduce the cost of long-term cardiovascular complications.
Let alone quality of life, obviously.
Oh, yes, it improves the quality of life.
That occurred to me again when you were talking, and it was very easy to understand what you're talking about. So again, as a potential customer, I was thinking, I need to ask my doctor about this. So you can kind of do it from both ends at the same time. So sometimes it's also educating consumers that this is something they should be asking for.
Yep.
And we've got to be careful of the Dr. Google effect, but your research is going to provide real evidence that this is, I'm not being super nervous or whatever. If it's 1 in 6, that's a serious number, isn't it?
Yes, I mean, you're spot on, Rebecca, because we have 2 consumer groups involved to advise on, what are the experiences having a delayed diagnosis of the disease, and how did they get the diagnosis in the first place? And the vast majority had to actively seek the diagnosis themselves. And so we're involving a consumer-based infographic company that's going to generate some, plain language leaflets, so that either doctors or even pharmacies that offer blood pressure measurement can, disseminate the information in a very easy to understand manner, so that patients are empowered to ask about it.
Great, I love it. Thank you.
So Amanda, I think we might go to the panel now. I do have a question for all of the candidates. First of all, I want to say congratulations on an incredible showcase of 4 brilliant 3-minute pitches, and the amount of effort that's gone into them by all of the candidates and successful winners today is incredibly impressive. But I also wanted to say that Amanda and I are going to advocate for this competition to continue, right, Amanda?
Absolutely.
So that we'll be back next year. So we've got a few minutes. So what I'd like to do is ask each of the successful webinar alumni winners to give some advice to the young you. So if you were mentoring yourself as the young you, what advice would you give a mentee about the importance of the 3-minute pitch and using different forms of media to deliver the pitch? So perhaps we'll start with Danny.
So what would I recommend to myself about using media? So essentially, I think that being able to describe your work in a lay language shows that you really understand what your project is about, and being able to explain it to your parents or a sibling that is not in the specific area is really important, and it shows what it means, what your little protein that you're working on in the lab means in the bigger picture. So I would recommend to my earlier self is just to talk to as many people outside of your field and try to explain to them what you're doing. And if they ask you questions, it means that you're not explaining it properly. So try to find different approaches to be able to explain the things that you get a lot of questions about.
That's an excellent answer. I love the fact that you try to explain it to parents and family as an example, because I think that's what we have to do all the time. It'll be happening a lot around the Christmas table coming up very soon. How about you, Yugeesh? What advice would you give your younger self about the importance of communication, the 3-minute pitch, and using media?
I think in a lot of ways, we all came into this field because we want to make a change in people's lives for the better. And I think being in academia, we are in an environment where our work is constantly criticized by our peers. It's constructive criticism, but it's sometimes easy to lose the real reason why we're here. And I think sometimes engaging with the media and then talking to the public about what we do, we see that excitement in their eyes, which in turn then comes back and fuels our own engines and reminds us why we're really here. And it kind of tells us or assures us things are tough in academia, but it's worth it because we are trying to do something great. And I think that's what I would remind myself. And I want to tell my younger self, do this, learn these skills to get this message across to the public, because that's where the real excitement lies. And that gives meaning to what we're doing. And there is help out there if you want to train yourself, because every institute, whether it's Monash or Florey, we all got great media teams. And if you are unsure, reach out to them and they'll be very much happy to help you out in these endeavors. So you don't have to wait until you're a senior professor. Learn these skills early and put yourself out there when the time is right. That's it.
That is terrific advice and very passionately delivered, and totally agree with you. How about you, Amy? What advice would you give your younger self about 3-minute pitches, communicating research, and using media?
I totally agree with what Danielle and Yugeesh just said, because I think that, communicating with a lay audience is essential, because if they glaze over, you're in trouble. And talking to, consumers or in my case, but patients, I think is really important. I think it's really important to engage with our digital natives as well. I am very fortunate to have 3 teenage daughters, and instruction on how to make a video is something that I listen to very carefully. Only for this in the past, despite the endless TikToks that have happened in bedrooms over lockdown, I've ignored all of the videoing. But I think that people out there who do this all the time do actually have some great pointers as well.
And over to Yon for the final thoughts on research communication and the 3-minute pitch.
I totally agree with what Danielle, Yugeesh and Amy have already said, and they've taken all my ideas already. I would suggest finding a partner who has some interest in directing and filming. But short of that, I think it's important to really step out of your comfort zone, be creative in reaching out to people, because in the end, we're doing this work, as Yugeesh has said, to help the people out there. So if we can't get the information out, then the work would not have value. So I thought the 3-minute competition was just a great incentive for us to, have a go at getting our message across. And I'm sure our 3-minute videos can be modified over time to form something that would look a bit more professional, perhaps, that can really be shared with the general community.
And I would say that all of you have given really great advice. Something else that I would pass on that I've learned is that often people, particularly in relation to the media, are scared because they have this perception that the media is there to tear them down. You're going to be accused of being a fraud, or, something awful is going to happen. Now, the fact is, in this space, that isn't going to happen. The media is looking for content. And if you can provide them with good and interesting content, they will, you know, it's a partnership. So I would also suggest that you think about developing some relationships with some of the key writers and broadcasters that you know that you might want to interact with, and don't be scared of it. It's of course, particularly if you do television, which I do, you know, the first time you do it, you think, oh my goodness, you're just, you know, nervous as anything, but it's actually not that scary. And once you've done it a few times, you kind of get over that and think it's not about you, it's about the communication of ideas.
I'd like to thank you, Rebecca, for being a tremendous co-chair today. I think we make a great team. Perhaps Heart Foundation might give us a gig in the future, because I thought it was a wonderful day. And thanks again to the alumni for your wow videos. It was fantastic. I know the Heart Foundation is very excited about these videos, and you may find yourself to be superstars on the Heart Foundation website in the future. And I'll just hand over to Amanda to close.
Thank you, Robyn. That is all we have time for today. The Heart Foundation is here to help our alumni wherever we can. So please reach out to the research program. You know, we have different departments within the Heart Foundation that we can connect you into, whether it be media and marketing or advocacy. Even IT might be able to help with some platforms around videoing. So there's lots of help available. Again, thank you to all of our panelists today. A special thank you to Rebecca and Robyn, who were brilliant. Thank you, ladies. And I'm sure we'll use the dynamic duo again sometime soon. We hope you all have a safe and enjoyable festive season, and we really look forward to reconnecting with everyone in the new year. Thank you all for attending today.